Everyone, welcome to Szenan-Balance. I'm the acupuncturist from Szenan-Balance and Chinese medicine herbalist. Good morning. It is New Zealand time 7:15 in the morning. Now, if you're on this live video, please give me a thumbs up and comment down there and say hello to me. And further on, please click share. So share this video. And today our topic is causes of neck pain. Causes of neck pain. Now, causes of neck pain. If you suffer from neck pain, or your family or your friends suffer from neck pain and they want to get some information from neck pain, please tag them to this live video if you're on Facebook and on Instagram as well. All right. Now, tag them to this video, this live video. Now, if you're watching replay, you can do it a bit faster, speed up, so you can finish this live video quicker. You know, on Facebook or on YouTube, there's a speed up function. So I won't talk that fast, but you can speed up and save some time. Hi, Siding on Instagram. How are you? Today our topic is causes of neck pain. So what causes neck pain? This is our main topic today. So thank you for joining us. Please say hello to me and give me a thumbs up and share this video and tag your friend whoever suffers from neck pain. Tag them in because they need to understand what causes neck pain. Right? What causes neck pain? Hi Eric, how are you? Nice to see you again. Now, let's start. The causes of neck pain. Again, we talked about the symptoms a bit yesterday, right? Neck pain, it can come with stiffness, not just pain, and the pain, the type of pain can be stabbing pain, sharp pain, achy, dull ache, you know. Then it can last, it can comes and goes, and it can consistencies, you know, stabilize and stay pain over there, you know, it doesn't change the pain level. Or what else? The pain can comes and goes, right? So, or it actually affect your range of movement. You can't move from one side to the others, okay? Or when you, or pain worse when you move to one side, or maybe backward, sideways, or doing this, or forward your head. All this range of movement, it may restrict it. Okay. Now, right, the reason causing the neck pain varies. There are a lot of reasons. Okay. Now today we're going to talk about what potential reasons will cause neck pain. Maybe your neck pain, maybe your patient's neck pain. Now, as I showed you this yesterday, so we see that this is cervical, right? Then I told you that I mentioned that it will move, right? We move, but without the muscle contraction, the muscle attached on the bone over here, right? All this bone, they're full of muscle in there. The muscle need to contract. Without muscle contraction, there is no movement. You know, you can't complete a movement without any muscle contractions. Therefore, one of the causes muscle tension and strain. That's one of the very common causes. Okay, so what caused the muscle tension in tightness and strength? That is while our posture. Okay, now I'm sitting quite straight, as you can see over here. See, now some people sit like this, as you can see over here. Some people always sit like this. You see? So they get tight. This is very poor posture. Especially people now have, cell phone and doing this. And doing this. You see? Very poor posture. In front of computer. Okay. So you always sit up there and tuck your chin in a little bit. Into the extreme and push it up a little bit. That's it. That is the right posture for you. Okay. Then yes, poor posture causing muscle tension and tightness. Now, working in front of computer without changing position, or not just computer, any work, like you're a painter, doing this in painting, you maybe an hour, half an hour, just doing one side, and look up and do that. And that causes pain as well in the neck. So you need to change the position every so often. Sleeping in with your neck in a bad position. When you sleep, from here to here, we have like this far. But when you sleep on the side, if I sleep on the side, my head like this. You see? This squash here, this become extend. The muscle extend over here. So when you sit on your side, you make sure that your pillow put it on here, and you have to have high pillow like this, about that far. So when you lay on it, you still lay on like this. So it doesn't do this. It doesn't do this. Okay. So this is important. Okay. So this is how you need to teach your patient if they have neck pain relating to sleep, even though they're not relating to sleep, but maybe sleep position or working position for too long, then that will prevent they get better. So you need to talk about this to your patient. Okay. If you suffer from neck pain, you need to think about those things. Okay. Sleeping on your back, face up, on your back, face up, is better for neck pain. But not everyone can do that. I trained myself. I used to sleep on the side all the time. Now I no longer sleep on the side. I just sleep on my back to protect my neck. And it was very hard, difficult. It takes weeks. It may take months for you to change the position of sleep. And I want to tell you that first you try to lay on your back and go to sleep, you get insomnia. You can't sleep because the sleeping position is always on one side. You always sleep on one side, get you back to sleep. But then when you suffer from neck pain, if you're like me, the neck structure is not right, then you want to change your daily position. Working, I used to sit like this. I didn't know that. No one tell me that. Not until I had neck pain. I searched for myself. Oh, my posture is very bad. And now I sit right up. So this is important. We learn. We learn every day. You learn from your disease. Learn whatever you suffer from. Okay. Now, exercise. When you do exercise, I remember that we do massage, practice massage. Then we have to jab the head, the neck. Okay. If the patient doesn't actually relax and you jab the neck, this is one of the massage technique, tweener technique. Well, chiropractors do that too, right? And you probably realize that chiropractors do more than us because you haven't been seeing real acupuncturists in massage therapy trainer. We do that too, right? But if you're not careful, and you did that, and the patient's not relaxed, and did that, they actually strain the muscle. Okay? And sometimes, like playing in a sport games, and you suddenly turn back, then you strain your neck, and that happens. Okay, that happens, right? That is just when you want to do exercise that happens. Now, injury. Another cause is injury. The injury happen a lot too. Okay, what injury? How does it happen? Okay, the injury can be a fall from a high, from high position, fall down to the floor. It can be a car accident. It can be sport. But in New Zealand, people play rugby. Wow, have you ever seen rugby? It's very well. I don't know whether I never played rugby. I guess for me to watch it is too dangerous, very dangerous. Hi, Happy Day. How are you? Very dangerous sport. Okay, I won't be able to do that. I want, and not just this football, any kind, basketball. It'll hurt your neck. But your purpose is not try to hurt your neck, right? But it happens sometimes. Accidents, right? Accidents happen. So when accidents happen, where the muscle and the ligament of your neck are forced to move outside of the normal range. Yeah, outside of the normal range. That's what happened. Okay, it can be a bone problem. It can be a joint problem. It can be this issue. It can be the muscle or ligament problem. It damage. If the neck bones, cervical vertebrae, okay, are fractured, the spinal cord may also be damaged. Spinal cord is you can see it. If I tip it in here, and yeah, you can see it in here. This thing came out. This is spinal cord. So all vertebrae, it's a round one. So round one connected to the other round one. So they become a cord. So they call spinal cord. Okay, that makes sense to you? I hope that makes sense to you. So neck, so if it's broken, it damages the spinal cord. The spinal cord got some fluid in it. It runs our main nervous system. A nerve run on the spinal cord. As you can see here, the yellow is nerve. It comes out from the spinal cord. So the main one, you can see it in here. This is the main one. There's yellow in here, in the middle, main one. That main one run in the spinal cord. Okay, just give you some idea. So there's another, you probably heard about wrist press. Okay, and that's due to the sudden jacking of the head, like behind. Who do that? Driving and stop. You go forward and you backward. Or dancing. Practice of dancing, and your partner get you back to that, and that happens. Okay. Or when you want to fall, slip backward, and that happens. Okay, slip happens. It will do wrist press. And I have patients who practice dancing, and that's what's causing wrist press. And ever since, she had neck pain. Okay. Heart attack. hip heart attack. So neck pain can also be a symptom of heart attack. Yeah. But it often presents with other symptoms of a heart attack, such as shortness of breath, sweating, nausea, vomiting, pain in the arm, especially on the left side, and the jaw pain. Okay. If your neck hurts and you have other symptoms of heart attack, what do? You have to call the ambulance straight away and go to the emergency, go to the hospital. You don't go to see any other practitioner. But of course, if your acupuncturist is around and they know what's happening, needle can help with heart attack. Needle can help with stroke. We will talk about in the future how needle acupuncture can help. Okay, but you may think, oh, why would needle help? Think about 1,000 years ago. We don't have Western medicines. How does Chinese doctor treat stroke and heart attack? Yes, acupuncture Chinese says we have our own method. And that's important to know. Something that is very simple and may save your life. It may save your family life. And I'll introduce in one video in the future. Okay, how to simply use needle, put on your fingers, or in here, or pressing here to save a stroke patient. But it's been using in Chinese medicine acupuncture for 1,000 years. For 1,000 years. Okay. Now the other cause of it is it's not a neck pain itself. It actually comes from other, which is meningitis. Meningitis is an inflammation of the thin tissue. There's a tissue surrounding your brain and your spinal cord, right? And brain's over here. Sorry, I haven't fixed this one yet. Right, this is your head, the scalp, brains, and so the tissue surrounding your brain and the spinal cord go down here, so they connect together. So in people who have meningitis, they suffer from fever, headache, and very often they have a stiff neck. Not necessarily pain, stiff. It may be pain, stiffness. Okay. Meningitis is a very dangerous disease. It can kill you. It is a medical emergency, right? So if you have any symptoms of meningitis, you need to go to emergency. Go to the hospital, right, with headache and fever with neck pain. So this kind of neck pain is different. Very, very stiffness, but always come with fever. So fever is more obvious. So this, don't treat it like just normal neck pain. You have to go to the hospital. Okay? You need to go to emergency. So you need to be aware of this. Okay. What other causes? Are there anything else apart from what we just mentioned? Meningitis, from injury, heart attack, and the muscle strain and tension. So we see a lot of neck pain from muscle tension, strain, and injury. So that's the main one that we see in our clinic. Not necessarily heart attack, but you need to know that. Not meningitis, but you need to know that. Well, neck stiffness or pain, it can be from others as well. So you need to understand this. Okay. So other causes. Other causes. What other causes? Other causes like Okay, I just got my friend's message that she's in hospital again. Okay, so other causes. Rheumatoid arthritis causes pain, swelling of the joint, and bone spurs. When these occur in the neck area, neck pain can result. So arthritis is one of the common issues as well. And you heard a lot of people have bone spurs, and it happens in the neck. Okay. Osteoporosis is weaken the bones and can lead to a small fracture. Okay. These conditions often happen in hands and knees, but it can also happen in neck. Fibromyalgia. Yeah, we see a lot of this as well. People say, I have fibromyalgia. It's a condition that causes muscle pain throughout the body, especially in the neck and shoulder regions. Okay. Now, as you age, the cervical disc can degenerate. This is known as spondylosis or osteoarthritis of the neck. Osteoarthritis is wear and tear issues happen in the neck, any joint. So neck is a joint, you know, the cervical vertebrae, two joint together, and there's joints. Okay, then this can, so osteoarthritis can narrow the space between the vertebrae. It can also add the stress, pressure, more pressure to the joints. So it's important to note it. Okay. If the structure change very bad, there's another one called that we heard about lumbar herniation disc, right? Have you ever heard about cervical herniation disc? Yes. More often it happens in the lumbar. The disc pop out. If you pull out in the front, this is the front. There's no problem at all. But if you pull out in the back, and that's a real problem. Okay, backs. In the back, you compress the nerve. So that is important to know. So it can happen in the neck too. It can happen in the neck. Okay. Spinal stenosis. That happen in the spinal column that narrows and causes pressure to the spinal cord. And the nerve root as it exits the vertebrae. This can due to long-term inflammation caused by arthritis or other conditions. Okay, this is another one. In very rare instances, neck stiffness and pain, it may happen to infection, tumor, cancer of the spine. So there's other issues, right? Neck pain, well, we don't see much of neck pain from cancer, the cancer on the bone of the neck, cervical, you know, and what do you call it? Thyroid tumor, thyroid cancer. It can cause neck pain too, but it's not on the back, it's actually on the front. It can be tied up on the front area. So that's another thing. So we treat that too in our clinic. We have experience to treat the thyroid cancer. Okay. Now you see a lot of causes, different causes. But again, the most we see in our clinic, you know, and as an acupuncturist, muscle tension, strain, and injury. That is more common. Right. Same as physiotherapy, chiropractor, osteopath. You see more of these issues through injury and muscle strain, position problem, poor posture in the clinic. Okay. Well, I haven't seen any meningitis case or heart attack that causing the neck pain, because those patients many going to hospital. But we've seen arthritis. Arthritis is common too, and neck spur. People keep saying I have neck spur and fibromyalgia, osteoporosis. Those are main cause of the neck pain as well. Very common, very, very common. And you see a lot in the clinic. Now compare with the others, like the herniated cervical disc. So it hasn't been happening that often. We see a lot of lumbar, but not a lot of herniated cervical disc. We do see some, but not a lot. Not a lot. Okay. Compared with the back herniation disc, we see more of this case than neck one. Okay. So yeah, acupuncture can help all this we just mentioned. A different cause of the neck pain. I want to mention something: stress. Especially for those people with poor posture. You have just about everyone has stress. Stress causing neck pain, very common, and that neck pain is causing the muscle tightness. Stress causing muscle become tight and tight and tight, and that is what's happening, causing the pain in the neck. Okay, that's it for today, and I'll see you tomorrow. Then tomorrow is Sunday. We're gonna talk about. There's not much to say about the symptoms, right? Now we need to talk about when to see a doctor. Let's say when to see a doctor. Okay. Well, what symptom it came out, you should find a doctor. You should go to the hospital. Okay. And then if we have time tomorrow, we can talk about what is the treatment. Okay. Or otherwise we put it in the next day. Okay. The next day for the treatment. After the treatment, when we say treatment, is go for your doctor, chiropractor, acupuncturist, osteopath, or physiotherapist. Okay, that is what we're calling about treatment. You get someone to help you. Then we're gonna talk about another day. We're gonna talk about, what can you do to ease neck pain at home. So some home program. What can you do for yourself? An acupuncturist will show you some acupressure point to work on. Acupressure point. Okay. And we can talk about the outcome for people with neck pain as well. Okay. So this is the purpose to let you know that all about everything about neck pain. Then in the future we can go deeper, talk about the neck herniated neck, talk about injury, and talk about more about specific disease that causing neck pain, and how do we deal with it. Okay, how do we deal with it? Okay, that's it for today, and stay awesome, and I'll see you tomorrow. See ya. Bye bye. America, thank you. I just realized that you live comment there. Thank you very much, America. Thank you, Eric. And the rest of it, I don't know your name because you didn't put your you didn't put the your name here to say hello to me. But please give me a thumbs up. Okay, I need to stop all this. Thank you. Okay. Okay. Let's turn off everything. Hi, Judith. Thank you. Thank you for being here with us. Support me.